All right. Well, Dave, thank you so much for chatting with me, because I remember years ago now, I had this conversation with you at one of the Explain Pain courses of, have you ever thought about making this for kids? And then that became my whole research topic and my focus. Now, this is years later. I've done a whole PhD on it.
Gosh,
do you remember that conversation?
You know, I do. I remember the course. It was quite some time ago, and I thought you were a bright young spark then.
Kind.
But I also remember that it wasn't long before then that I was asked to speak at a pain conference, and I was asked to speak on pain in children. And I admit I didn't know much about it, I still don't, but I went and looked at the available literature then, and there wasn't much. But there was a few glaring things that really shocked me, and I can't remember the exact numbers. You'd know, something like 8 to 10% of kids around 8 to 10 had an ongoing pain state. And I must admit I was quite shocked by that, quite shocked by that. And it was one of what I call in my career, pain in childhood, one of the missing groups who were missing out on a revolution that was happening in spinal pain and other pain. So I remember that moment, and things have certainly shifted. And Josh, it wasn't that long ago, was it? It was only, let's say, 10 years ago. There's been a lot happen. In 10 years, and you're a big part of that. It's really great to see it.
Well, I must say, I have a PhD student, Beck Fechner, who I'll mention now. She's doing stuff on teachers in schools, and I'd love to hear your thoughts on preventative pain science education. So if we teachers are the experts at teaching.
Yep.
If we give the teachers the framework of the biopsychosocial model, DIMS and SIMS, something like this, a framework about pain, maybe the new kids' books we're working on, and let them run with it. Give them a project, have a go, embed it in the mental health curriculum. Do you think there's merit in that? And I mean, we're going to test this, but I'd just be interested to hear your thoughts on the potential of preventative education.
Absolutely. I think ultimately this epidemic of pain that we have in right through childhood, adolescenthood, and adulthood, I think the ultimate prevention must come down to education, number one, and education at a young age. And as you know, we don't have any data on that, but it just makes so much sense to intervene early. We've seen benefit with early education with other health issues. So why not get in there with pain early?
Well, that's exactly been my thought process. And that's what we're building these resources, we're testing them, we're trying to be as rigorous as we can. But I just think the same. I totally agree with you.
The other thing, Josh, that I'm retired now, but I can't help reflect on where we've been. But I also believe that the world of health has missed a important part of psychology. We use health psychology a lot, but we've almost avoided educational psychology. And that's educational psychology, not just for adult conceptual change, but also the assimilation of knowledge that children have. And handing it over to teachers to do get them interested to do some of the research makes a lot of sense, as well as, I believe, picking up health clinicians to pick up some elements of sort of teaching skills, teaching strategies, contextualising it, making it age appropriate, etc.
Yeah, sure. And I have one other idea I want to run past you, because when I worked in Western Sydney, in that area where there's low socioeconomic status, 1 in 6 didn't speak English, adult pain patients in a pain clinic setting, I would show the draft versions from 2018 of the first book, and they would say, I didn't think it could be that simple. And it's like the education we were delivering in a lecture format was just going over the patient's heads because of all these language barriers, cultural barriers, understanding barriers. So if we make it really simple, could we say, look, I know this is not, we don't want to belittle anyone by saying, this is a kid's book, it's for you. We want to say, hey, what do you think about reading a really junior resource? Do you think that could make it more accessible for adults? Or is there a place for that? Or should the kids' book stay in the kids' arena?
Well, I think any child who is using these books, the adults should have read them as well. That's number one. Whether it goes outside that, I don't know. There is great potential for it, but I don't know the answer to that. As you know from the Explain Pain work, I know from our adult education work and what we're now doing is coming back using lots more comic, graphic novel stuff, simplifying it more and more into just 3 or 4 target concepts, bringing it down to a level. So there'd be some adults who would pick that up, I think, and really run with it. Think, oh gosh, I've never thought of that. Is that pain as a protector? Oh my gosh. If things in there that might seem simple, but they're powerful, and probably one of the most powerful things of all that you bring up and that we've now been able to bring up because of the brain mapping revolution is that when we hurt, brain lights up like a Christmas tree. There's so many areas engaged, but that's one of the most liberating things you can have because it means that there's so many things you can do for it. There's so many things to start to sort of work with. So if an adult reads that and gets that concept, thinks, hang on, that's good. I'll go and talk to someone else about that, or read a bit more about that.
Yeah.
That would be fruitful.
So it's that accessible, bite-sized starting point is kind of maybe anyway. We don't know, and we need to test it. But okay, that's great. And the other thing that from our pilot testing, we've been doing some studies on this. We've found that some adults who have chronic pain, who then want to be able to explain their experience to their kids, potentially these books could be helpful. So we're hearing, like we're interviewing the kid and then the interview finishes and the parent says, hey, I need to tell, tell them
that would be another group I hadn't conceptualized, but yes, that would certainly be a relevant group, and it would be a very powerful thing to do.
Yeah, because I think it's just giving, like the recipient of a conversation needs to have it in their language. So an adult who hasn't had distilled pain science, it's so hard to try and convey, I'm off work because of this, or I'm doing this.
No, Josh, that's another. Sounds like you've got about 8 or 10 PhDs coming off this.
I'm a researcher, that's what I want to do. And so I think running ideas past you...
That would make a lot of sense. That would make a lot of sense.
Okay. It's testable, and I think that's the key here.
Go for it and do it.
Okay, all right. Check us in 10 years' time. We'll see if we've answered the question.
Great. Well, that's great. Josh, and what's wonderful is seeing from those early days of meeting is seeing the change that's happened in this recognition of pain in children, and once again, it's how important that is to set somebody up for the issues of life that come later, to handle it, to pass it on. I think it's where we have to go.
Yeah, great. Thank you so much.
Good on you.
It's been awesome.